Welcome back guys. Now let's discuss about a topic which is very important for your exam, that's the central venous pressures. See, central venous pressure, let's try to understand it. What is the center of the entire venous system? All the venous blood have to come and collect in the right atria. So central venous pressures are nothing but the right atrial pressures. Okay, just trust me, try to understand like this. The central venous pressures are nothing but the right atrial pressures. Okay, almost in the right atria, the pressure is almost zero. Okay, the pressure in the right atria is almost zero. Now let's see what are the conditions in which the central venous pressures are going to increase and the central venous pressures are going to decrease. Okay, for example, see, the central venous pressures are increased in which conditions? In the conditions like right-sided heart failure. Think logically guys, whenever there is a right-sided heart failure, okay, the right side of the heart is not contracting properly. When the right side of the heart is not contracting properly, what happens? Blood is not going to the pulmonary trunk. So, blood is accumulating in the right ventricle. Now, all the blood will generate a back pressure, so that right atrial pressure increases. So, when right atrial pressure increases, automatically central venous pressure increases. So, central venous pressure is more in right-sided heart failure. True. In cardiogenic shock. What exactly is cardiogenic shock? Simple. Left ventricular failure. When left ventricle is failing, blood is not properly going into the aorta. Cardiac output decreases. When blood is not efficiently going into aorta, what happens? Blood is accumulating in the left ventricle. Now, this left ventricular pressures increases. Now, the increase in the left ventricular pressures goes into the left atria. Left atrial pressure increases. Now, whenever there is increase in the left atrial pressures, that will back generate into the pulmonary arteries. Okay, pulmonary veins, into the pulmonary vasculature. So, pulmonary vasculature pressure increases. Okay, there will be more pressure in the pulmonary vasculature. So, back from the pulmonary vasculature, the pressures are going to translate back into the right ventricle. From the right ventricle, the pressures are going to come into the right atria. So, what I am trying to put into your mind is, whenever there is a right ventricular failure or even left ventricular failure, in both the conditions, right atrial pressure increases. If right atrial pressure increases means, automatically central venous pressure is going to be more central venous pressure is there. So, in both right ventricular failure as well as left ventricular failure, you can have increase in the central venous pressure. Okay, no doubt. And constrictive pericarditis. What is constrictive pericarditis? The heart is surrounded by a layer called as a pericardium, and the pericardium is getting calcified. Okay, now that calcified pericardium is compressing the heart. Try to understand it. Okay, the calcified pericardium is not letting the heart to relax. Heart is now getting squeezed. Try to understand like that. So, when the heart is getting squeezed because of this calcification around it, so automatically the pressure inside the heart increases. Right atrial pressure increases, central venous pressure increases. Simple. And cardiac tamponade. What exactly is cardiac tamponade? Again, heart is surrounded by pericardium. Now, whenever there is any damage to the heart wall, okay, whenever there is any damage to heart wall, now blood is going to leak into the pericardial cavity. Okay, for example, let me show you here something like this. Imagine that this is the heart. Okay, now heart is surrounded by pericardium. Okay, heart is surrounded by pericardium. Whenever there is any damage to the heart wall, for example, because of myocardial infarction, heart wall gets weakened. It's undergoing it's totally undergone ischemia followed by infarction. Ultimately, there is necrosis. Okay, now what is happening is, now the blood from this damaged wall, now it is leaking into the pericardial cavity. So, the entire heart is now getting surrounded by a blood, and that blood is going to become clot. Okay, that blood will become clot now. So, now this clot is going to compress the heart. It's not letting the heart to relax. Now, heart is totally surrounded by the blood. Okay, now where exactly is the blood? Blood is now in the pericardial space. Now, that clotted blood is actually compressing the heart. So, automatically the pressure in the right atria increases, automatically central venous pressure increases. So, in cardiac tamponade, constrictive pericarditis, in both the conditions, CVP is more. Okay, CVP, central venous pressure is more. And tricuspid stenosis as well as tricuspid regurgitation. Try to understand guys. Now, this is the right side of the heart. In between right atria and right ventricle, what is the wall present? The wall present is the tricuspid wall. Now, this tricuspid wall is now stenosed. Okay, tricuspid stenosis. Whenever it's completely stenosed, it's not letting the blood. Okay, it's completely stenosed. Now, blood is not moving from the right atria into the ventricle. Blood is not moving. Why? Because there is a stenosis. Now, whenever there is a stenosis, what happens? Now, the right atria have to contract more. It have to contract more powerfully to send the blood from the right atria to the right ventricle. Whenever it is contracting more powerfully, more pressures are going to be generated here. So, automatically central venous pressures are going to be increased in tricuspid stenosis. And in tricuspid regurgitation, what happens? Now, this wall, whatever we are discussing, okay, let me try it again here. This is the right side of the heart. Here is the right atrium. Here is the right ventricle. The wall which is present in between them is the tricuspid wall. Now this tricuspid wall is not closing properly. Now when it is not closing properly, there will be regurgitation of blood. Okay, regurgitation of blood during the systole of the right ventricle. Now this regurgitant blood is going back into the right atrium. This regurgitant volume of blood will create an extra pressure over there. So automatically central venous pressure increases. So central venous pressure is going to be increased both during tricuspid stenosis as well as tricuspid regurgitation. True statement. And pulmonary hypertension. Okay, pulmonary hypertension and pulmonary edema. Sorry, pulmonary hypertension, pulmonary embolism. So what happens in pulmonary hypertension? Again, let's make it as simple as possible. This is the right side of the heart. Here is the right atrium. Here is the right ventricle. From the right ventricle, who is going to come out? Pulmonary trunk. Pulmonary trunk is going to come out. Now what I am saying here is, in pulmonary hypertension, in this condition of pulmonary hypertension, there is more pressure in the pulmonary arteries. Okay, pulmonary hypertension is defined as more than 25 mmHg pressure in the pulmonary arteries during systole. Whenever there is more pressure here, now do you think blood is going to easily go into the pulmonary trunk from the right ventricle? No, blood is not going to go into the pulmonary trunk. So blood will start to accumulate here in the right ventricle. So right ventricular pressure increases. Whenever the right ventricular pressure increases, blood from the right atria is not going to enter into the right ventricle. So right atrial pressure increases. So when right atrial pressure increases, automatically central venous pressure is going to be increased. So central venous pressure increases in pulmonary hypertension, true. And in pulmonary embolism, what exactly happens? In pulmonary embolism, again same thing, same stuff. Now same right atria, right ventricle, and here is the pulmonary trunk. Okay, now in pulmonary embolism, here is an embolus. Here is an embolus. Okay, here is an embolus present like this. Okay, now blood is not moving forward. Because of this embolus, all the pulmonary vasculature, even the pulmonary vasculature will undergo vasospasm. Okay, the pulmonary vasculature will undergo vasospasm. So automatically the pressure inside the pressure here increases. So that increase in the pressure will translate into increase in the pressure in the right ventricle. Right ventricular pressure increases. Automatically right atrial pressure increases. When right atrial pressure increases, central venous pressure is increased. Now one important point which I want you to know is, in all these conditions, central venous pressure increases as well as the jugular venous pressure also increases. Right? Because jugular venous pressure is nothing but the right atrial pressure, which is nothing but central venous pressure. So central venous pressure increases means right atrial pressure increases. Right atrial pressure increases means jugular venous pressure also increases. So in all these following conditions, jugular venous pressure is also more. Okay. Now, in which conditions jugular venous pressures are going to be? Okay, central venous pressures are going to be decreased. Central venous pressures are going to be decreased whenever there is a decreased venous return. Okay, in the conditions of decreased venous return, the central venous pressure decreases. You can ask me how. For example, just tell me. Try to understand like this. When venous return decreases, okay, now where do all the venous blood come? From the superior vena cava, from the inferior vena cava, all the blood is coming to the right atria. Whenever there is no venous blood coming, automatically right atrial pressure decreases, central venous pressure decreases. So central venous pressure is decreased in decreased venous return. When venous return decreases, automatically CVP decreases. Hypovolemic shock. What exactly is hypovolemic shock? Hypovolemia. There is low volume of blood. Whenever there is low volume of blood in the body, automatically the blood going to the right atria decreases. Okay, the amount of venous return, whenever there is hypovolemia, less amount of blood is there, so the amount of blood going to the heart decreases, so automatically CVP decreases. And excessive vasodilation, whenever vasodilation occurs, just think and tell me, whenever vasodilation or venodilation occurs, the amount of blood going to the heart decreases or increases? Automatically decreases. Whenever there is a venodilation, there is peripheral pooling of the blood. Blood is going to pool in the peripheries. The amount of blood going to the coming to the right side of the heart automatically decreases. So automatically right atrial pressure decreases, CVP decreases. Okay. So excessive vasodilation or venodilation will also decrease the central venous pressures. So this is one topic which can come in your exam. In your exam, they will ask you something like this. In all of the following conditions, CVP increases, except. In all of the following conditions, CVP decreases, except. In all of the following conditions, JVP increases. In all of the following conditions, JVP decreases. So these type of questions are possible. Okay. Hope the video is helpful. Thank you.